Nurse at Rancho Springs Medical Center Emergency Room.
First question. What do you, as a nurse, registered nurse, do on a daily basis?
Well, registered nurses do a lot of different things in different areas of the hospital. So I work in the emergency room. So we treat people who have medical emergencies or urgent emergencies of where they can't see their doctors. So we treat them. Nurses help the doctors assess them, carry out orders like giving out medications or like putting casts on and stuff. So nurses help with that, and then we help with educating the patient when they leave, before they leave the hospital, educating about the medications being prescribed or anything else, like any alternative treatments like heat cold therapy for pain, stuff like that.
That was a really good answer.
Oh,
I'm sorry, I was inspired. What schooling did you have to go through to get to where you are now?
So for nursing, you have to go to accredited nursing school. So there's private universities, there's the Cal States and the UCs. I went through National University, which is a private college. I had to get my GE, which is my associate's degree, and then I applied for the nursing program. Before you apply for the nursing program, there's like tests you have to do, entry exam tests, and then schools usually base your scores and your grades and total it up, and they usually take like the first, it depends on like the school, but my school was like the top 50 scores went in. So, and schooling for nursing was 22 months for me because I got a bachelor's in science of nursing.
How many days and how many hours on average do you work per week?
If you're full-time at most hospitals here in California, it's 36 hours a week is considered full-time, and our shifts are 12 hours, so we work 3 days a week for 12 hours.
What has been the most frustrating or challenging problem that you have had to solve?
So when I read that question, and usually I want to answer it with like a patient case, but I've been a nurse for like 4 years, and I feel like the hardest thing I had to solve was learning not to get burnt out from nursing, because we work a lot, and we deal with a lot of people, a lot of sick people. We deal with their families, their loved ones, so it can be very taxing on a person. So the most difficult thing is like learning to love my job even after all of those things, like, because it can be very hard to love your job when some days you just hate every moment of it. So that's definitely the hardest thing I had to solve, was staying in love with my job, which I still am, so which is nice.
That's good. That's good. Do you have anything else that you want to say about your job? Any positives, negatives?
Yeah, okay, so a positive, even after, like, because nursing, I feel like, is not really a rewarding job. Not all your patients will say thank you for this, thank you for that, but that just having that one patient who are just like so grateful to you, it erases like all the stress and all the hardships that you did in 12 hours. If your whole 11 hours and 58 minutes was really bad, all your patients were belittling you, demanding of you, and their family just think like they don't like appreciate you. But if you have that one patient and they look at you and this is to say, like, not even a thank you, but just a look or a gesture that they're thankful, it just makes everything worth it.
It's rewarding, right?
Yes, very rewarding job, that's for sure.
All right. Well, thank you so much, Hannibal.
Thank you.